Sexually transmitted diseases in the aging population. According to the Administration of Aging, in 2009, there were about 40 million people aged 65 or older in the United States alone. Between 2007 and 2011, the Centers for Disease Control and Prevention show chlamydia and syphilis infections increased by 31% and 52% respectively in adults over the age of 65. According to the National Survey of Sexual Health and Behavior, about 50% of men and 40% of women over the age of 60 are sexually active, but only 6% use condoms. According to a study published in the New England Journal of Medicine, 73% of 57 to 64-year-olds, 53% of 65 to 74-year-olds, and 26% of 75 to 80-year-olds are sexually active. Although many people have their own opinions on what exactly constitutes as sex, sex includes vaginal, oral, and anal sex, which leads to higher risk of contracting or spreading an STD. There are many misconceptions about sex and sexual activity. Some of these include the fact that condoms interfere with pleasure or erection. Condoms are just for preventing pregnancy, so because the aging population is past the childbearing age, there is no need for condoms. And STDs are usually thought of as a problem that occurs in teens or young adults, but not in the elderly population. Whether we want to believe it or not, sex is happening. With the increase in availability of Viagra, Cialis, and other erectile dysfunction drugs, more seniors are able to have sex. Many members of the aging population were married for many years and did not have to use any type of protection. Condoms are thought of as something to prevent pregnancy, not always as something to protect against STDs. Many of the aging population did not have sexual education. Sexually transmitted diseases, also known as sexually transmitted infections, are usually acquired by sexual contact. The organisms that cause these diseases may pass from a person in blood, semen, vaginal, or other bodily fluids. A person can have an STD and show no signs or symptoms at all. Some of the common STDs in the aging population include syphilis, gonorrhea, and chlamydia, which are all curable with medication, and herpes. According to the Centers for Disease Control, over a period of 5 years, STDs in the age 55 and up category dramatically increased. As you can see from the chart below, syphilis had a 135% increase, while chlamydia had a 111% increase. And according to a study completed by Massachusetts General Hospital, men over age 50 are 6 times less likely to use a condom than men in their 20s. Syphilis. Syphilis is an STD that can be very serious and have many complications when left untreated. Syphilis is easy to cure in its early stages with antibiotics. Syphilis is spread by direct contact with a syphilis spore during sexual activity. A condom won't always protect you if the sore is not in an area that is covered by the condom. Signs and symptoms include a sore that may look like an ingrown hair or bump, a body rash which develops in the later stages, and some people have no symptoms at all. Gonorrhea is an STD that can cause infections in the genitals, rectum, and throat. It's easy to cure with the correct medication. Gonorrhea is spread by having vaginal, anal, or oral sex with someone who has gonorrhea. Signs and symptoms in men and women are similar and include a burning sensation with urination, abnormal discharge, or in men, painful or swollen testicles, and in women, vaginal bleeding between periods. Chlamydia. Chlamydia is an STD that can cause serious complications if left untreated. Chlamydia is the most common STD in the United States. However, it is easy to cure with the correct medicine. Chlamydia is spread by having vaginal, anal, or oral sex with someone who has chlamydia. Signs and symptoms in men and women are similar and include a burning sensation with urination, abnormal discharge, or in men, painful or swollen testicles. Herpes. Most people who are infected with genital herpes do not know they have it. There is no cure. Herpes is spread by having vaginal, anal, or oral sex with someone who has the disease. Herpes can be spread if the condom is worn, if the sores are on the surrounding skin. Sometimes there are no signs and symptoms at all. During a flare-up, a person may have painful genital sores. There are certain risky behaviors when speaking about sex. Some of these include having more than one sexual partner, changing sexual partners frequently, having oral, vaginal, or anal sexual contact without a condom, taking part in sexual activities while under the influence of alcohol or drugs, or having sex with someone you know nothing about, for example, a one-night stand. There are a couple ways to practice safer sex. One of these is abstinence. There are other ways to feel close to someone without having sex. Practice monogamy. Only have one sexual partner. If you must have more than one, limit your number of partners. Get screened for STDs yearly or before finding a new sexual partner. And always use protection for all kinds of sex. Some tools for safer sex include latex condoms, both male and female, and dental dams for oral sex. If you use sex toys, keep them clean and do not share. At the end of this presentation, a hands-on session on how to use a condom correctly will be given. If there are any questions or if you would like additional help, please go to the link below on how to use a condom correctly. Talking to your doctor. Sometimes doctors do not remember to talk to their aging patients about sex, or they have difficulty initiating the discussion. It is important to talk to your doctor about your sex practices and request an STD test before each new sexual partner. Always keep the lines of communication open. Doctors can be a great resource for questions relating to safe sex practices and STDs. A survey was conducted of 135 primary care physicians, and it was found that about 60% of physicians rarely or never discuss sexually transmitted diseases with patients over age 50. According to an article published by the International Society for Sexual Medicine, 38% of men and 22% of women have discussed sex with their general practitioner since the age of 50. There are alternatives to sex. Other intimate acts have less risks of spreading STDs and include kissing, touching, and hugging, holding hands, making eye contact, lying in each other's arms, looking at old pictures together, walking together, reading together, or talking about how you feel to one another. Remember, Just because you can't get pregnant doesn't mean you don't need a condom. Talk to your partner. If you start a new relationship, go together to get tested. And use a condom.